Good morning, and thank you for waiting for us to get started here. My name is Tim McBride, and I'm the vice chair of the board, standing in for our chair, Serena Mohammed. And I'm going to get us started. I believe we have a quorum, so I'm going to ask for approval of our Zoom video from March 16th, which serves as our minutes for the March meetings. Do I have a motion?
This is Colleen. I move to approve the meeting minutes.
Okay.
Second.
Okay, I have a motion and a second, and I guess do we have to vote to approve those? I believe yes. Just put your finger up or wave your hand if you move to approve. So
Approve.
yeah.
Approve.
All right. The minutes stand approved, and the first thing we're going to do is we have several new board members, and Amber Boykins Sims is here from the city and has graciously agreed to come to our meeting this morning to help us swear in our new members. And I really appreciate you doing this, getting up early and doing this for us. So thank you, Amber. And maybe you can take us through the oaths for our 4 new board members.
I am back. Did I miss something?
Oh, I was just introducing you and thanking you for being here and saying I'm going to turn it over to you to swear in our 4 new board members. Thank you. Did you hear me? Oh, there you are.
I
Amber.
wanted you to see me so you know that I'm here and real. And then I'm going to grab my book and we'll get started. Good morning, everyone. And thank you for your service to the city of St. Louis. Well, good morning. I am Amber Boykins Sims, the city registrar. You're about to take your official oath of office. What will happen is you will raise your right hand. I will say aye. You will say aye. You will state your name, and then you will repeat after me. Everyone, please raise your right hand. And now you will repeat after me. I. And now everyone can repeat after me once you state your name. Please state your name.
Kristen Simpson.
Colleen McNicholas.
Having been appointed by
Having been
Having
appointed
been appointed by
Mayor Tashara O. Jones,
Mayor
Mayor
Tashara,
Tashara
O. Jones.
approved by
approved by
the city of St. Louis,
the city
the city of St. Louis
to the office of.
to
to
the
the
office
office
of
To the office of
Now you state your board.
the city
Board
of
of Health and
Louis.
Hospital
Board of Health and Hospital
Of the city of St. Louis,
of the city
of
of
the city of St. Louis.
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 do solemnly swear
do
Do
solemnly
solemnly
Do
swear
solemnly swear
that I have all the qualifications
that I
that
that I
have
have
all
all
of
the
all the
qualifications
qualifications
and am
and
and
am
am
and
and
not subject to
not
not
subject
subject
not
to
subject to
any of the disqualifications
any of the
disqualifications
disqualifications
named in the charter
named
named in
in
the
named
charter
in the charter
for the office
for
for
the
for the
office
for the
office
office
or employment
or employment
or employment
I'm about to assume,
I'm about
I'm
to
about to
or
assume
about to assume.
that I will support
that
that
I
I
will
that I
will
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 support
support
the Constitution
the
Constitution
the
Constitution
Constitution
of the United States
of
of
the
the United
of the
States
United States
and of this state,
and
and
of
and of this state,
and the charter and ordinances
and the charter
the
and
charter and
ordinances
ordinances
of the city,
of the
of
city.
the
of the
city,
Of the city.
that I will be
that I will be
I will be
influenced only by
influenced
influenced only by
the consideration of fitness
the
the consideration of
consideration
fitness
of fitness
in the appointment,
in the
in the
in the
appointment,
appointment,
and the appointment,
promotion,
motion,
promotion,
promotion,
demotion,
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 suspension,
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 or discharge
or
discharge
discharge
or discharge
of officers
of
of
office
of
of
officers
officers
or employees,
or
or
employee
or
employees,
employees.
that I will not
that I will
That I
not
will not
expend nor authorize
spend or
expend
authorize
spend or authorize
the expenditure of money
the
the
expenditure of money
expenditure of money
otherwise than
otherwise
otherwise
otherwise than
for the adequate consideration
for the
for the
adequate
adequate
consideration
consideration
and efficient service
and
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 efficient
efficient
and
service
efficient service
to the city,
to the
to the
city,
city,
to the city.
and will faithfully discharge
and
and will
And
faithfully
will faithfully
discharge
discharge
the duties of my office
the
the
duties of
duties of my
the duties of
office
my office
or employment.
or
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 employment.
employment.
Once again, I want to thank you for your service to the city of St. Louis, and on behalf of myself and the Honorable Mayor Tashar Jones, we want to welcome you to this board, and we look forward to working with you as you get and start and complete your work. Thanks again for all of what you do for the city. Please plan to come down to room 118 in City Hall and affix your official signature to your oath page. Once again, if you have any additional questions, you can give us a call at our office here and we'll be happy to help you. Once again, thank you for your service to the city.
And thank you, Amber, for coming and doing this. Appreciate that so much.
You're welcome. Thanks again, everyone. Have a great meeting.
Thank you. Well, okay, we're all sworn in now, and we have our quorum, and so I'm going to turn it back over to our leader, Dr. Mahdi, who's going to, their next agenda item is staff survey updates and onboarding.
Thanks, everybody, and welcome to today's meeting. Really excited to share with you our employee satisfaction survey. I would like Rhonda to just unmute and just take a bow because she is responsible for making sure this happened. A month after I joined, I told Rhonda that I wanted this completed. This was something that was also on her docket as in her current leadership position. And so the results that I will be sharing with you are about a year and some change out of the original one. So again, the first one was about a month into me being here. I wanted to really just get a level set of where the staff were on a range of topics that we'll talk to you about. And then the results that you'll see are a year and some change after. Rhonda, anything that you'd like to say?
No, just thank you for your recognition. And I want to say that the results are due to your leadership. So we appreciate you. So thank you.
I didn't even pay her to say that. So Thursday's going good so far for me. So let me just open their screen. And in a second, I will just ask everyone to confirm that they can see the slides. Can everybody see the slides?
Yeah, we're seeing the, yep.
Great. So again, this is the 2022 to 2023 employee satisfaction survey. The responses come from across our bureaus. Rhonda was able to improve employee response rate by how much, Rhonda?
We had, I think, 67 responses, and the last time we had around 50. So we did improve some. I don't know the exact number offhand.
It sounded better in percentage, Rhonda. I need you to rock with me here, man. You
Okay.
really improved employee response rate, Rhonda. And so here you can see that we had a pretty good spread across all bureaus. Great to see the environmental health bureau sort of lead the charge in response rate. To be fair, they are the largest bureau in the department, so the response rate is very appropriate proportionately when you think of the size. This chart gives you an idea of the years of employment that are reflected here. So you can see that 37.3% have been here for a year or less. And that also reflects the fact that I have broken a city record in hiring staff in the first year. So we do have a lot of employees, which is what we want to see. But it's also really reassuring to see the 23.9% reflect more than 10 years, and in total over 30%, over 6 years of service here at the health department. We had 13.4% reflected in supervisory staff. So a lot of these responses really do reflect the actual bread and butter of our team. And so what is really beautiful to see, and that's a change, we'll be able to show you the degree of change in the next couple of slides, is that in general, everyone's satisfied with their job. So 71.6% agree, and you can see that agree or strongly disagree. Strongly agree. No coffee yet, folks. Just roll with me this morning. And so that to me was a really big marker, and we'll talk to you about percentages. So we asked them some specific questions across the board about their job and the support that they receive to do their work. In the top 3 increases here, supervisor treating them with dignity and respect, clear understanding of duties, and understand how their work contributes to the department's strategic plan. We saw increases across the board, with the clear understanding of the duties expected increasing by 9% in just over a year. In the bottom 3, I received clear and timely information about changes within the agency. In the past, I've received recognition for praise, and my performance evaluation provides me with meaningful information. Again, we saw improvements across the board, but really the one that I'm so proud of is the fact that folks are seeing the increase in recognition and praise for doing good work, and that's been increased by 17%. When we looked at the health department's management practices, again, improvements across the board. When we asked the department as strong leaders with a strong sense of direction and purpose, that answer increased by 13%. We asked a new question that got a strong rating about timely responses for supervisors and managers. And our supervisors are consistent in administering policies or concern around employees. Also want to shout out that a big issue that was reflected last year was perceived favoritism in the workplace. And we've seen an improvement of 14% with that perception as well. In looking at health department characteristics, this was an area that I really loved. 24% increase in agency morale. I want to see emoticons and joy across the Zoom chat this morning, in coming out of COVID, where people told me they were burnt out, woefully feeling not valued, with so many issues right now in public health. To see agency morale up 24%, I never get an evaluation. So child, this was my evaluation. And we have agency morale up 24%. I'm so proud. But we've also seen increases in investment in employee learning, training, and growth, decision-making and control. They feel more empowered, and employee being able to make suggestions, all up above 10% each. Also a 15% increase in trust among employees. The only question where there was a decrease was departmental safety procedures. I spent 3 weeks meeting with every single section. So not every bureau, every section. They each got 2 hours. I brought them lunch, and we met in intimate settings so that there was no more than 10 people at any time. And they talked to me about some of their concerns across their board after BPA. And you know that we're downtown. There's been some downtown related violence. There were concerns about the overall city's approach to safety. So we really were intentional. So before the results of this came out, I'm proud to say that I'd attended to this, was advocated to the mayor about safety across the board. And I can tell you that we now have mandatory training at the Department of Personnel level for all employees in the city. We also have implemented a safety officer, Scott Gary, who is a supervisor here in our Environmental Health Bureau and a wonderful leader. So we have already started to make strides towards that question, even before I knew the answers. So we're really proud to say that we are improving. But I would just wanted to highlight that the areas of most improved here are agency morale, career advancement opportunities within the organization, been very intentional about making sure that staff can get additional trainings, opportunities. They serve on committees. We have been able to get published. We are sending folks to national conferences to share their work. So that is up 21%. And we also saw an increase in 19% of mentoring for another supervisor, my supervisor or a contractor. I've also signed on a leadership coach who is working bureau by bureau, starting with our communicable disease team. So I hope to see that aspect even more increased in the next year. When we look at health department characteristics around diversity, the highest scoring was acceptance. There's a feeling of acceptance and appreciation for diversity with a really strong score of over 4, and that's up 10%. And then work groups are trained to incorporate the opinions of others is also up. We again have advocated to the Department of Personnel, and they have brought back mandatory diversity and inclusion training for the city. All staff will be required to be compliant with that by the end of the summer. We are also found funds to bring in an individual diversity and inclusion trainer, and we will be releasing an RFP for that within the next month. So when we asked staff their top 5 reasons for job satisfaction, they talked about serving and impacting the community, their coworkers and team culture, the supportive leadership of supervisors, their job assignments, and the work from home balance that I instituted coming out of COVID, allowing those that have jobs that allow them to up to 2 days working from home. And that has made a big change in an environment where we are still a ways from equitable pay for city employees. And we also still have a city mandate living requirement. So that work from home balance is something that was important to me to institute within the department. Top 5 reasons for job dissatisfaction continue to be low salaries, poor raises and bonuses at the city level, delays on waiting for other city departments, inadequate staffing, lack of procedures and resources for jobs. We're now I signed a contract with both an accounting firm and a grants management firm to bring SOPs, standard operating procedures, and protocols to the department. And the hiring of our Commissioner Anwuri was intentional around this because it is an area of expertise for her. Management issues that I had more concrete conversations around. And again, I told you one of the interventions there was we brought in a leadership coach to work with the department over the next year, going bureau by bureau. And then the red tape with other departments that prevents us from being able to do what we need to do in a timely fashion continues to be an issue. They listed for us their top 10 proposed improvements. I'm proud to say that most of these are already being attended to. And those at the city level, I've made clear to the leadership. I also will be sending the mayor and her leadership a copy of the results of this survey that includes these proposed improvements for their awareness. And lastly, we have a second page for other suggestions. You will get this tomorrow as part of your board report, your monthly board report, but we're going to add these slides as an additional PDF so that you can see this granularly. So I will stop there and take any questions. So proud of this department. Thank you for the love in the chat, but I'll open it up to any questions. And Craig said 34% improvement in response rate. See, really good.
There you go. That's really good. That was a good report. And are there any questions from the board?
I just wanted to say that my favorite improvement recommendation so far was that more notice be given for food when it's provided. So I thought that was really great. That's incredible.
Dr. Bradley, let me tell you something. National Public Health Week, it was almost a riot when the staff were not aware that the burgers were on site. There were really good burgers that the staff had worked really hard on. So let me tell you, as a leader, I paid close attention. They say, A, feed us, and number 2, give us adequate time to know that you are feeding.
That's right.
And I think that is fair, Dr. Bradley. I think that is fair.
But the other thing that I thought was great, and I think it's something to keep in mind, is the reflection. I think it was number 1 as a factor that motivates people is serving and impacting the community. And I think that is a nice overlap with the motivation to improve evaluation of services so that employees are getting the feedback about their impact and further motivating their performance. So just wanted to make that observation.
Here, here. I'm gonna ask that Shantae, who's gonna do a quick overview of some onboarding procedures that she has taken the lead on for the department. Share screen. Shantae, if we can do what I did at the last board meeting and just flip through the new onboarding document as well as the template that you put together.
Sure, let me see if I can do this quickly. Give me just one moment, please.
And Dr. McBride, what do you have after this for me?
After that, it's the Department of Health website tour.
Okay, Kim, are you in a position to share screen and do that while Shantae gets prepared?
I can be, yes.
Okay, so I will ask our new, rank spanking new, newly minted supervisor for the communications bureau. So congratulations to Kimberly Vandenberg, who has served the health department and the city for many years, has recently had a promotion. Her first date is April 24th. Look out for our very cute picture together that will make it across all social media platforms at that time. Kim has been a communications department of one over the last couple of months after Harold's retirement. I have been so impressed by her leadership, the fact that not a ball has been dropped during that time. And I'm pleased to announce that she is currently onboarding a new PIO and will be onboarding a new program specialist within 2 weeks. And we will be filling her position and are confident that that will be filled by the end of the month. So please give Kim a lot of love and support. Please also bear with her and be patient on any requests that are communications related. She is getting onboarded herself as a supervisor. She is onboarding 3 new employees over the next month. And again, she is holding the entire communications bureau together. So congratulations to Kim. I'm going to ask her to do a very brief 5-minute overview of the website for our new board members, just so that you're aware of what we have at your disposal. Thanks, Kim.
Thank you, Dr. Monty. Give me one moment. Okay, hopefully everyone is seeing the screen now. So this is our main health department webpage. It's embedded within the City of St. Louis webpage. That the city's web address is St. Louis, stlouis-mo.gov. And our health department page, the short URL is stlouis-mo.gov/health. If you follow it from the main city page, you'll have some additional breadcrumbs. If you know what that means, those are extra words in the URL that kind of help direct where the page is. But for short URL purposes, again, stlouis-mo.gov/health. So on this main page, you'll see 3 sections at the top of the screen. Get started. These are some hot topic buttons that will take you to information almost instantaneously. Middle section, top requested pages. This is the 5 pages that are determined by an algorithm that people are requesting the most on the health department's page. So you'll see news and media is first, followed by 2 pages of our COVID-19 response, our coronavirus information, which is kind of up-to-date ongoing information regarding the virus, as well as our COVID-19 data page, which I'll show you here in a moment. Frequently asked questions with raccoons in December, that kind of varies. We had an issue a few years ago with some raccoons in the city that were testing positive for December. So we put some frequently asked questions up there that kind of rotates in and out depending on what people are searching on our website. And our health department contacts there is number 5. Obviously, people want to be able to reach out to us. That leads me right into our 3rd section, contact information. You'll see our main phone number for the health department, as well as our COVID-19, or now in these days, more communicable disease hotline. Once we saw the Mpox outbreak situation last summer, as well as our direct address and our hours. City hours standard Monday through Friday, 8 to 5. I mentioned COVID-19. We do have a dashboard. Also, again, I'll show you that here in just a moment, but we do have a synopsis of the COVID-19 data on our main page for those who just want to get a highlight view with a link directly to that. Our mission, vision, and Notice of Disabilities Act. This is all part of our accreditation process that we went through back in 2016-17. And we're currently working through our reaccreditation process right now. Kudos to Rhonda, Shantae, and their team for really kind of taking that charge, as well as the rest of the staff, including myself, that are trying to get documents to Rhonda for additional information. Director of Health, we want to recognize Dr. Madi Hashwayo Davis, our director, with some information on her, as well as our latest health news. These are up-to-date news releases. We'll be actually looking to issue some new news releases in the coming month or so. So you'll be seeing that updated, as well as a place for us to land some videos and photos that we have done through our partners with STLTV. And again, thank you to them for helping host us today. We also have a link to our social media. This is our Twitter feed. We try to tweet out at least 1 or 2 posts a day. Thank you to Dr. Madi for this morning. She had an opportunity to speak at the Robert Wood Johnson Foundation's conference that is here in St. Louis. She spoke during their welcome dinner last night. An employee spotlight. We want to recognize employees that are in our department for the work that they are doing. And so we have that there. We'll talk a little bit more, I think, about this in our monthly update, but we have 5 different procurement items that are available right now. 1 notice of funding availability and 4 RFPs, and there'll be a 5th RFP that will be uploaded in early May that was recently passed by the Professional Services Agreement Committee. And at the bottom of the page, a health department menu. This will take you to links to our sections of the department. And give me 1 moment, please. I need to hide my controls. I talked about the COVID-19 data. This is our data dashboard page. Again, I guess it goes a little bit more in depth to that synopsis that we saw earlier, including we can look at cases by zip code, by demographic data, and by social vulnerability by zip code. This also lists public testing locations, financial transparency in terms of the monies that have been spent based off of COVID-19 funding, and a project that we did with Washington University on COVID-19 data modeling with Trace STL. And those are all different sections of that website that you can dive into a little bit more when on your time that you have. And I just want to keep this kind of going. COVID-19 obviously is part of our communicable disease section. This as on this page, we have information on HIV/AIDS care services. Obviously, this is one HIV/AIDS is something that we really try to take a spearhead on with our projects. Our education and planning, medical records. We tend to see an increase of this, especially when people are looking to find employment in the restaurant business, looking to get the records of their hepatitis A shots. We also saw this kind of when a lot of employers were mandating COVID-19 vaccination proof. So there's a way to reach out to medical records, our TB control, as well as our hepatitis and HIV surveillance. I talked about a little bit HIV. We also have an HIV/AIDS dashboard. Dr. Madi was actually kind of spearheading this when she was with on our board as part of the Fast Tracks and also part of the Fast Track Cities initiative when we first got that started in December of 2019. Let me take you that really quickly. So this is a look at that dashboard. Again, some demographic data, testing and care locations. This is all information that we try to update regularly. The testing and care actually comes directly from the hiv.gov, so that is updated through the federal government. And we try to continue to share resources when available. That COVID-19, we also circles back to vaccine information. We've been providing COVID-19 vaccines since January of 2021. We do have some information on COVID-19 vaccines on our vaccine information page, as well as when we are able to partner with local healthcare clinics for influenza vaccines, a link to where we can find those. And school immunizations, while we don't offer direct immunizations for school, we have a contract with one of the FQHCs to help us administer those. And we also want to make sure that the parents can find school required immunizations of information available. So right now we have the 2022-2023 school year. We'll obviously need to be updating that here in the next few months as we look forward to the 2023-2024 school year. big launch that we did a few months ago was our Behavioral Health Bureau. Thank you to everyone who's been supporting this initiative. We did work on having its own landing page on the health department's website. Here you can read a little bit more about the Bureau. Similar to what we saw on the health department's main page, top requested pages. This is again an algorithm driven. And so these are the pages that people are seeking out on the website, not things that we have tried to push them to. And evidence, mental health resources for self-care is one of the top ones. We launched that page shortly after the shooting incident at Central CVPA High School here in St. Louis, as a way for people to find resources and find the self-care items that they might need. Kudos to our team. I'm going to scroll down here just a moment to our CDC Foundation team that has been helping spearhead this effort as we've been launching this bureau. We are getting people hired, and we will doing the work, continuing the work that the CDC Foundation has helped us start with. But the big item they have done is a snapshot, which I believe the board received a month or so ago. This is a look at what the work that they have done to this date. And there's quite a bit of information. So again, hopefully you'll be able to dive into this on your free time. Mentioned communicable disease, I've mentioned behavioral health. Don't want to forget environmental health, as Dr. Monty mentioned earlier. This is one of our largest bureaus in the department. There are 6 sections of this bureau: air pollution control, animal care and control, community sanitation, food and beverage control, and vector control. So a lot of information on all these different sections. Need to build out some more, and that hopefully in the next year we really kind of craft some updates to this webpage. I've been having communications with the city's web team that oversees the entire city website. I'm hoping to kind of move that forward. And my apologies, because I saw Bobby on the call. I do not want to forget our family community school health, formerly known as women, children, adolescent health. Obviously, we would be all inclusive as we really work on health equity for the St. Louis region. But these are some of the areas that they work in. They work in lead screening services, especially for children up to age 6 in the city. They can be screened for lead in our blood levels to ensure that they are healthy in that area, as well as working with schools' health services, immunization exemptions for minors. Show Me Healthy Women, we've been really trying to re-engage this program. We had a great nurse come on board a few months ago, and she's really keeping this program active and getting it going. And our health equity, we are working on different aspects. And Bobby, I don't want to put words into your mouth, but working on our Food RX program, our maternal child health, we're really trying to build that out. And we do get a lot of requests for birth certificates. In the city of St. Louis, they are actually held by the Vital Records. So we do have a link here to direct people to that section. That's kind of a quick overview. I probably have gone over my time, so I apologize. Is there any questions about the website?
Right, very thorough, appreciate that. Are there any questions? Dr. Bradley, you made a comment in the chat about the HIV dashboard. Do you want to dive in on that?
Yeah, no, that's it exactly. I'm not sure if Natalie has received a report of that, but my understanding is that when you do go to the data overview or something like that, it's showing maybe like 0. Nope, that didn't say that. Well, yeah, I don't know what this person. I got an email. I'll look into that again and send a notice.
Okay.
And Dr. Bradley, if you want to even forward that over to me, I can try to follow up with our team here regarding the concern.
But definitely that virally suppressed 0, yeah, it just probably needs to be paused until we update.
Okay. Yeah, that's definitely something that I would need to engage the web team. Why I have a lot of editing abilities on most of the health department websites. There are some limitations to what I'm available to do per my permissions. And so some elements like that, I need to connect with the web team. There's a staff of 4 that, again, they oversee the entire website because they have some additional permissions that I am not privileged to have.
Okay.
Thank you, Dr. Bradley, and thank you, Kimberly. One more quick thing I'll mention is I think that you may want to look at the list of the board members because we've made so many changes to the board members. that probably needs to be updated, so.
Yes, you are correct, Dr. McBride. Especially after today's swearing in, the Board of Health page does need an overview, and that'll be one of the things I'm working on doing. And so to that fact, to those new board members that were sworn in, congratulations today. I will need to reach out to you to receive a picture and a biography from you to be able to update that information.
Yep, that would be great.
Thanks so much, Kim. I just also want to say that this is an area of passion for Kim, but there was never real capacity, additional training for her. And in addition to being the PIO supervisor for every facet of communications and education, to also be expected to keep up with an entire website is a lot. So we've been trying to advocate for this in the budget, to no avail yet, but we will continue to make our requests known. But once Kim has onboarded her staff in the next 3 months or so, you will see some significant updates to the website. But like I said, we need to give her a little bit of time. Dr. Bradley, I think I may have cut you off. Okay. I'd like to move on to Shantae now. Kim, that was a fantastic overview. Thank you.
Thank you. My apologies. I'm trying to stop. Okay, there it is. Thank you.
Okay, wonderful.
Shantae, if you could just give a little introduction to what you've been working on and why, and then show the board briefly. Thank you.
Sure. So good morning, everybody. I'm Shantae Llewellyn, Health Marketing Administrator here at the department. And as you all know, and we've talked about onboarding, and the onboarding experience for our new hires is extremely important. And we identified a need to improve that experience for our new hires. So we decided to take the approach of approaching or attacking this momentous challenge through a QI project. We did understand that we definitely wanted the QI or the onboarding experience to be more efficient. We knew we wanted it to be more comprehensive, and we definitely wanted to make sure that it included the voice of our department as a whole, our internal community at large. So the first thing that we did, in the vein of it being a QI project, is we decided to have a brainstorming session. So we solicited feedback and input from many of our staff members, our team members, and I want to quickly show you what that looks like. Let's see if I have it here. I do, and bear with me as I kind of go through here. So we had a lunch and learn where we had an onboarding session, and we had a wonderful response. And as you can see, there was so much feedback, and we did narrow it down to some key items that people felt like they should know as soon as they come on board. Just some those little good to know, need to know items, as well as provide support to supervisors, people leaders, in terms of the things that they need to do, deliverables, to ensure that their new hires were in a good place, especially in their first week. Okay, so I hope that this changes with me. We are at the point, and we've been working on this. This is a sizable endeavor. So we actually had to divide the onboarding QI project into 2 teams. So there was one team that was focused on the welcoming component, the soft part of it, where we let them know that we're very glad that they're on board with us, that they're with us now, and that to avail ourselves to show them around and make sure that they're comfortable and they have the things that they need, the tools that they need, and they're off to a great start. And then also the things that are more substantial and logistics, in terms of making sure that they have the right documentation, they have and references for their role and as a civil servant, as well as a guide for reasonable expectations for their first week to 6 weeks on board. So several outcomes as we've gone along is, first and foremost, we were able to develop a onboarding and offboarding check sheet. This check sheet is pretty robust. I don't have that readily available, but I will be able to share that at a later time. But it does outline the process and the journey from when someone is hired, the documentation that they'll receive, from whom. This document is kept by the people leader, the supervisor, with access by others in administration, to ensure that any and all documentation that's needed by that new hire is provided to them in a timely fashion, as well as there's additional guidance for different other documents that they would need. So the next thing, another outcome that we had was a quick reference, and I'd like to share that. And I think this is the one that the director would most like for you to see, and I can wrap this up with this. Can you see this quick reference here?
Yep.
So from all of the feedback on our team with the more technical, we heard that there were several items that people were not sure of where the lunchroom was. They weren't sure of parking. We have people that are new to the department, new to the city. So we gave them a full, especially with our department being an older department with a rich history, there were several components that we wanted to make sure that this quick guide had. First and foremost, our history, as well as our mission, values, a list and contact information for our leadership team, gave them a quick tour of the city itself. Some good to know information as a civil servant, and some internal things such as our quarterly employee events and that, as well as references for our life insurance, medical insurance, payroll. Parking is always important. So this is all reflective of feedback from those that have just come on board and those that have been here and said, hey, you know what, I would have found this to be extremely helpful had I known. Another thing that we have that's unique is that we have so many acronyms within the Department of Health that we even included a quick reference for each of the sections on things that they may commonly hear and may not be familiar with. And then finally, one of the suggestions was from our wonderful communicable disease section. They had drafted something during our COVID response, and this gave guidance as to if in fact someone receives information or receives a question from the community, how to direct them. So they don't have to go and say, okay, let me take your name and number and call you back. They have a baseline reference for just commonly requested needs or questions that the community they may receive from the community. So we're really excited about being able to provide that to the community, to the new hire. In addition to this, we've also and I'll stop sharing. I'll just go ahead and wrap this up really quick. So in addition to this document here, every new hire is going to have a quick reference. They'll also have an overview of what their first 6 weeks will include, as far as what types of training and training opportunities that are going to be there, where they're going to, if there's any mentoring opportunities, anything that they can expect to experience in their first week will be listed there, as well as any other items that people leader will deems helpful for that role will be included in this folder. I know that there's a lot that I have thrown at you. I'm very excited about this and hope to be able to present it in its entirety to you at a later date once we have finalized everything. But that we are on our way, and we're very excited about sharing these with our new hires.
Thank you, Shantae. This was a big area of feedback for us when I first joined the health department. There was no training, there was no onboarding. I didn't get trained or onboarded, child. So coming out of COVID, Department of Personnel was not in a position to do training of any kind. So to have Rhonda's leadership in heading this section of the Epidemiology Bureau and Shantae joining the team, we have really made great strides, as you can see, in what I hope will be not only exemplary for the department, but for the city as a whole. People need to feel like they know their roles. Even in my section meetings a few weeks ago, staff were still talking about the fact that they had been here, but they were just being given these online trainings, but didn't really know who they were in the department. And they felt like they were being underutilized. So I want to empower the leadership, the executive leadership, who are also stretched, burnt out, and have so much on their plate, to have these easy references to make onboarding accessible and much more manageable. and to also build in areas of accountability with, 1 month out check-ins and things of that nature to make sure people feel more at home and have what they need. So I'll stop there and have any questions or comments before we move on in the agenda.
Yeah, that's
Also,
great.
just want to uplift
Mhm.
Dr. Corey's comment where he says
Yep,
that the Community Engagement Committee should link with Kim to support efforts here. I really, really support that. As soon as the committee is up and running, I think Kim would really appreciate the support during this time where she's basically building a whole bureau and section from scratch. I also see, we don't mind the cats, Dr. McBride. And thank you, Kristen, for your encouragement and congratulations and the impact that this onboarding will have on the team. Now I'll go back to questions and comments. Apologies.
yeah, but are there any other questions? And that was a great, I'll share the applause from Dr. Bradley and others. This is a great handout. It'd be great to have one of these. So any other questions from the board? It's really nicely done, Shantae and others, whoever did this.
Thank you very much. I look forward to sharing it with you all.
Shante, if you could add it as a PDF for tomorrow's report, I will
Sure.
send that with the employee survey. Rhonda, if you could also provide Shante with the PDF of the slides that you gave me for the all staff with the employee, we're gonna give that to the board as well. Excellent
Okay.
work to both of you. Thank you.
I agree. Okay, well, the next item is committee updates, and I'm gonna put in the chat here. You got an email from Serena, and that thanked you for your responsiveness and serving on committees. So I'm just cutting and pasting from that email the list of the committee and the committee chairs and who's on the committees. I'll do the round robin now to do the committee reports. I'll start, I think, with the governance and nominating committee with Linda.
Good morning, Tim. The Governance and Nominations Committee has not convened yet. However, I have the names of those members interested in joining. I plan for us to meet in May. We have a pretty heavy lift this year. We have four board positions that will be becoming available. And our chair, Serena, will end her term as chair in March of 2024. And Dr. McBride is one of those individuals who will be terming off the board. So we will need both a chair and a vice chair in the new year. So lots of work for the Governance and Nominations Committee, but I've got some great people who are interested in joining. I'm going to send them a doodle poll and we'll get going on our work. Probably sometime this fall, we'll be seeking nominations from you all, and hopefully we'll be able to give you some suggestions on skill sets in which we're interested and in need of. So more soon. Thanks, Tim.
That's great. Thank you. Any comments or questions for Linda about that? You do have a heavy lift coming up, so please see what you can help her in any way. So, okay, I'll turn now to the academic committee, which I chair, but we also have not met, but seems like these meetings turn around pretty quick. So we will we'll meet before the next meeting, I hope. And Craig, you sent out a nice summary email, and I did send a note to our colleague from UMSL. So we're going to follow up on that. And is there anything else that you want to add to that, Craig? Because you sent a nice note. We'll have a forum.
Thank you, Doctor. Nothing to add.
Okay, that's great. And then our final committee is the communications committee, I think that's what it was. Yeah, oh, community engagement committee, I'm sorry, which doesn't have a chair, so I don't know who wants to speak on that behalf. Probably haven't met either. Well, maybe we'll move on and that one, maybe when we we'll get a chair named, I'll mention that to Serena, and then you all can meet. Unless there's anybody from the committee that wants to speak. And I see the note from Dr. Bradley. Thank you. So good suggestion. So if there's no other questions about the committee updates, I'll turn it to Dr. Monty for the departmental updates. I'm sure you got a lot to tell us. You're on mute.
I do. I really appreciate all the participation from board members in general. I want to uplift Linda, Dr. McNichols and Dr. Tepe, who sent me a really thoughtful email led by Linda around maternal child health. So you'll see that reflected in this month's report, and that'll be an ongoing priority. But they took a lot of time to ask me a lot of really intentional questions, hold me in my leadership capacity accountable to what that looks like. So you will see a dedicated presentation on maternal child health at next month's board report. Bobby Williams, the bureau chief, will be spearheading that, and will take liberties as to who from his team he invites, or if he'll take care of that on his own. But it's that kind of accountability that I really appreciate, feedback as well. I also am loving Dr. Bradley's idea about a meet and greet for staff and the board. I think we can think of something over the summertime, maybe even get people outside and get some food with appropriate forewarning that food will be served. See, I'm learning already, folks, so we can definitely do that. I will now share the departmental updates. Previously, I told you all that I will not be sharing every single slide. So it is up to you to really, are you seeing the right slide set, the right? Okay, so it'll be up to you to go into this in depth. As a reminder, every Friday after the Board of Health meeting, you will get a PDF of the slide sets for those of you who are visual learners, a PDF of a Word document with more narrative report for those of you who want to get into the granular. And I will also attach with this month the employee satisfaction results, as well as a copy after a lot of demand of Shantae's and Rhonda's team's onboarding document that I think would be really helpful for all of you to have. So welcome to this month. This is the March report, data from March that is reflected, that we get to you in April. So let's talk a little bit about our high impact items. You heard a lot about the employee satisfaction survey, so I won't go into detail with that. I also was really honored to be invited to participate during Black Maternal Health Week, which was last week. A reminder to us all that Black women are still 3 times more likely to die than white women at childbirth in this country, statistics that have been consistent for many, many years, completely unacceptable. I'll ask Kim to put in the chat a beautiful toolkit that the National Black National Black Maternal Health Week organizers put together. It has everything you could imagine in one toolkit, data, information, ways that you can uplift this work. So please check the chat. But I joined Dr. Kabele, Janelle Kabele, who is the first ever Black female chair of a department at WashU. Let me say that again. The first ever Black female chair of a department at WashU School of Medicine in obstetrics and gynecology. She is a fierce maternal health advocate. And she invited leaders from across the region, including myself, Dr. Kanefa Cunningham, Dr. Ebony Carter, who is a national OB-GYN expert and just Black woman magic across the board. I see Kristen, very enthusiastically nodding her head. And the regional director for HHS, Region 7, of which we are a part, Joe Palm, was the distinguished guest to talk about Black maternal health. This event was incredible. It was the first time that I really got excited about convening regional leaders in a way that will help to coordinate this work. So with Bobby's team now bringing maternal child health with behavioral health as my 2 biggest priorities over the next year, coming out of the COVID-19 pandemic, more on that soon. I also want to draw to your attention, we have a lot of new funding opportunities in this month's report. I am asking you, please, please, please take time to forward across your networks. We now have funding to support the healthcare worker safety training, sexually transmitted infection treatment monies, And the big ticket item here is the opioid support and crisis response. So we have behavioral health dollars available to the community. They asked for this. We have provided it. So please make sure that those go out. We also sent these RFPs for behavioral health to an extensive list of behavioral health leaders across the region that we have built with our CDC team. Last but not least, I'd like to congratulate Shantae, who is now a CMQOE professional with 10 years of on-the-job experience on one or more of the areas of the certified manager quality organizational excellence body of knowledge, and a minimum of 5 years of this experience in order to get certified. She is now a certified manager of quality organizational excellence, took an exam that was not easy and passed it very recently. And as CMQOE is able to lead champion process improvement initiatives, support strategic planning and deployment initiatives, motivate and evaluate staff active in quality improvement projects, manage projects, determine and evaluate risk, and employ knowledge and management tools and techniques in resolving organizational challenges. Congratulations to Shantae on this new certification. In this employee spotlights, we also celebrated in the last month Animal Care and Control Appreciation Week. So as part of that, you'll meet one of the members of our animal care and control staff. This is a hard job. I think some people just imagine animal care and control being like saving cats from trees really cutely. They are oftentimes, finding rabid, dogs, animals that are dangerous. They are trying to attend to a very high backlog of animal care and control calls across the city every single day. In fact, a lot of times they need to have a police escort with them because of how dangerous their tasks are. These are highly trained individuals. So please take the time to meet Abel Lopez, who's been with the department for many years and is of service. And I want to offer my thanks and appreciation to our animal care and control team who do this job diligently and have done so. When I joined the department, you've heard the statistic from me, but you'll never stop hearing it. There were only 2 animal care and control officers for the whole city. We have built that team out to 7 and we are still growing. We recently hired a dedicated supervisor to that team. So really excited about that. You can read more about where we are with influenza, but just to reassure you, the numbers are low, even though this was a record season with over 3,400 confirmed cases. That is a record season over the last decade. COVID-19, low community level, meaning while transmission continues to be high, we still have a lot of transmission. I was on CBS News just this week talking about a new variant that is not a variant of concern, just being monitored by the WHO. So this will always be with us, but we can now start to think about this and really prioritize the most highly at risk, which is our elderly and immunosuppressed. I will let you take a look at our violence prevention and behavioral health data. I will just say that please make note of the fact that our contract with the CDC ends at June. At that time, they will hand over to us a strategic plan that I've seen the draft of. It is phenomenal. There is going to be a health equity toolkit as part of that strategic plan. And there is a data dashboard for the opioid crisis. We're also doing a lot of educational tools. So you'll see some infographics around naloxone. And if you've been following us on social media, which you should, because you should all be retweeting us and amplifying us all the time as board members. If I can be an old auntie that is on social media, so can you. So asking you to uplift all of our social media to really get education out there as well. I'm going to move on to a lot happening around health promotion, so please check those out. But we have hired 69 people since I started at the health department, and in the last month we hired 5 and only lost 1. So the metrics are improving. Our onboarding and retention efforts are beginning to have impact. The last slide that I'm going to spend time on is just to talk a little bit more about Black Maternal Health Week. We really wanted to support the work of doulas in the community, so I joined the mayor at SSM's Doula Connection event to honor their work. We have a current RFP, as you know, around reproductive equity that includes support specifically and separately for doulas. So we have extended the deadline for that, and we're hoping to get some more submissions. I'm thankful to say that SSM is working on an application as we speak to support their doula community. And we've reached out to the leadership at Jamaa Birth Village and their fearless leader, Okansula, who is a tireless leader in the state and nationally for doulas who provide such culturally competent, specifically anti-racist and pro-Black woman care and increasing health networks. I want to shout out the Birthing Justice film on PBS right now. Kim, if you could put a link in the chat. We have many leaders, including some of the ones I've mentioned, who are part of this incredible, first of its kind documentary around Black maternal health. In the picture there, you see me with the director, Monique Matthews, who put together something that's almost impossible, something that is both alarming, transparent, sad, and deeply joyful, bringing dignity and integrity to the birthing stories of Black women. So please see that. And I joined her and the Brown School and Jamal Birth Village to do the first screening of this movie that's being showed across the country in honor of Black Maternal Health Week. Again, want to thank Bobby Williams and his team for their leadership in maternal child health. And you can look forward to a dedicated presentation about what we're doing in this space and what is coming, and new partnerships. Shout out Generate Health that you will hear about next month. So I will leave you guys to catch up on everything else. But again, a lot of links to all of the money that we have made available to the city and the community for them to look at all these links. Look at what you just need to copy and paste into an email and then put your little listservs in and send all the money out. Look at that. And then lastly, come and support us at our events. We are going to be at Earth Day this weekend. And there's a lot of COVID-19 clinics. Remember that the federal mandate has been lifted early of the May 11th deadline. I will be joining Anduela Jolly of IHN at the Hood Connect next week. So please check IHN socials for the dates and times to talk about Medicaid and the impact that that will have. That was brief, but hopefully good. I will stop here and take any questions or comments. Please note that Kim has put some links in the chats of our social media that you should all be following and uplifting, and also the Birth Justice video link in the chat.
Dr. Mahdi, that was not just good, it was great, as usual. So, and I want to give you a shout out, as you know, for the quality of these reports and the thoroughness of them. I really appreciate that. And before I turn to Colleen, I just want to reiterate how important our maternal health topic is, and you know, the statistics you cited around how devastating this is for African American women. So I think I applaud you for the focus on that, and I hope the board, you'll continue to keep the board apprised of that. I think that's great, and great call outs as usual to all of your staff. So I appreciate that. So Dr. McNicholas.
Yeah, thanks so much, Tim, and echoing a job well done. I have a question specifically about the recent actions taken by the state that will limit access to our trans community. I think we're likely staring down yet another public health crisis, specifically in this population, not just in access to care, but also community safety. I'm sure there will be some self-resourcing of medication supply, so perhaps some harm reduction opportunities and even some criminalization of patients and providers. So I'm wondering what the city is thinking about in this space and how the board can help support any efforts to help the community.
You're on mute.
Oh, Dr. McNicholas, I just can't thank you enough for your leadership and for lifting up this really important topic right now. It is so important to us, and this is something that we're taking very seriously. As you saw, many of you have seen our counterparts in the county put out a statement. We at the city are finalizing a statement because we wanted to not just rush it. We are doing some intentional preparation around our what we may or may not be able to do in this space from a policy perspective. And so I just want to spend a little bit of time talking about that briefly. So I will invite at future board meetings, the mayor hired a new policy lead coming out of the mayor's office, who his name is Casey Milberg. In response specifically to the anti-trans legislation that is happening at a state level, I reached out to her about a month ago to formalize a process for policy development in the city. When I joined, there was nothing happening. Craig Schmidt was the only person in the health department that alone was responsible for all policy change, which is absolutely unsustainable. And so we met with Casey, and since then we formalized a formal process for policy development. And the priority policy development right now is trans inclusive and trans supportive legislation if we are empowered to do so. So at the first meeting, we invited Dr. LJ Punch and the Regional Health Commission to speak to this topic. As you know, Dr. Punch has reached out to you to add your thoughts to what priorities the LGBTQIA+ community would like seen. We also have a committee of LGBTQIA+ leadership at the mayor's office that is led by her liaison, Nick Dunn. And they are working with Casey to really help us put together comprehensive both statement and policy around here. Again, the clincher is if we're empowered. It depends where things land in the states and if there will even be anything that's permissible at the city level. But whatever is, we are very clearly pro-trans health rights and trans rights in general. So after this meeting where we brought together leadership from Dr. Punch, we brought together the Regional Health Commission, Casey Milberg, who I just talked about as the new policy leader, and the city councilor. We then reached out to SLU Law to provide us capacity to increase policy development at this level. So I'm proud to say that we are in the last stages of a formal partnership where we will have summer research law students to help us with this priority legislation, as well as an overall audit of all public health policy that has ever been written to see what needs to be thrown out, amended, or what looks okay. So they will be helping us, and they are also working on an elective in perpetuity in this partnership that gives us increased capacity, because again, until I can hire people, that is an issue. Lastly, I want to say to the trans community that our silence was not in any way reflective of a lack of support, and I apologize if it did seem that way. We are in the final stages of the statement from the Public Health Department, but wanted to be thoughtful about what that said, given the fact that we are not in a position yet to know what policy changes we can enact until final legislation is in place. However, Casey Milberg, in partnership with me, have been advocating using the weight of our positions, and the mayor and the mayor's office have been very clear and put out statements along the way about the fact that we denounce strongly anti-trans legislation of any kind at the state level. So I'm going to stop there, Dr. McNicholas, because I want to make sure specifically that that was an answer to the question, or if you have a follow-up question or any other clarity. And honestly, Dr. McNicholas, any suggestions that you'd like to see from both the health department and the city?
No, that was really great. And you clearly have lots of great folks, the right folks on board to do that work. One of the things that I just think we should all think about are ways that we could capitalize on existing structure. So for example, I'm sure the HIV working group has some harm reduction around needle sharing and those sorts of things that we could probably translate across issues. And so just thinking about how to use some of the great work the city's already doing, but translate it to a new population.
That's a fantastic idea. Dr. McBride, in the past, as you know, we've put out statements in support of what we believe are public health crises. We've done this against racism as a public health crisis on this board in the past. I would defer to you and Serena's leadership, but I would ask, as the Director of Health, that this board considers a similar statement and move quickly to organize who would lead the drafting of such a statement, the dissemination and the formalization of such a statement to support the formal statement that will be coming out of the Department of Health in the city.
You read my mind, because that's what I was going to suggest. Because we have done that in the past. We've come out as a board making a statement about important issues, related to COVID and disparities and health equity and other things. So I would recommend that as well. I think you're right to wait until, the legislative session ends May 12th, and then we'll have more clarity about what the state is doing. But I firmly support that idea of having the board come in and support or comment on what you're doing and back it up. That was a great question, Dr. McNicholas. Thanks. Does anybody else want to weigh in on that? While Colleen's on here, could I ask about the issue around the board that's in play right now? Do you have any comments about that? No, that's really up in the air, but that's
Kim-
another
Kim,
issue that's really been heavily on my mind, so.
Yeah, you cut out for a minute. Comment on what specifically?
The
I'm sorry.
abortion pills, the
Oh.
mifepristone, yeah.
Oh, yeah. So mifepristone. So right now, so for folks who aren't sort of caught up, there was a lawsuit basically suing the FDA to remove mifepristone as an approved medication. That lawsuit was filed intentionally in a court in Amarillo, Texas, where there is only the possibility of receiving one judge. That judge ruled as we expected them to rule, essentially ordering the FDA to remove mifepristone from as an approved medication. They appealed that ruling to the Fifth Circuit, which is equally not great for abortion case law. They came back with a partial decision, essentially telling the FDA to go back to the approval REMS, the regulation that it had originally approved the medication back in 2000, which essentially does the same thing as the original order. It makes it so difficult for folks to use and access that it would essentially eliminate it. The FDA then appealed to the Supreme Court, who issued a temporary stay that was supposed to expire yesterday. They extended that stay till Friday. So we are waiting still to hear what the Supreme Court will decide. Simultaneously, the attorney generals from 18 states that are considered to be supportive of abortion access, Illinois being one of those, filed suit in a Washington court, asking the court essentially to order the FDA to not change anything about how mifepristone is approved. That case was decided as expected. And so now the FDA faces essentially two different decisions. And so as it sort of sits today, the states who participated in the Washington case will likely be able to continue to use mifepristone and misoprostol as the preferred regimen of medication abortion, while other states could potentially lose access to that medication. So that's sort of where we are. The importance of this case is actually far more reaching than abortion itself. It is a opportunity. It will be the first time that a court has said essentially that the scientific process by which the FDA goes through sort of that robust evaluation of data and then ultimately, open comment period and approval of medication will be challenged. And if folks, regardless of the abortion issue, if folks want to see just how dangerous this is, I encourage you to read the decision out of the Texas court. It is quite appalling and anti-scientific. And so I think we are from a scientific sort of standpoint, we are at a critical moment where the FDA's authority and processes are really being challenged by ideology. And so we'll see what happens.
Thank you, Doctor, for that report. I think it's important to put that into the mix of the challenges we're facing in maternal health. So any comments or questions on that? That's one other thing we'll want to clearly monitor. And I knew that we were waiting on the Supreme Court decision. So other questions about Dr. Monti's extensive report? We got about 5 minutes left here in our meeting. I might have one question, Dr. Monti. I think I read that there's a fourth booster approved for older than age 65. Is that right, for COVID?
Yes, FDA has approved a new booster, but also a streamlined schedule for COVID-19, which will make it easier for people to understand how they should maneuver through boosting. I will ask Kim and her team to put together social media and also just a quick summary document in the next couple of weeks that we can disseminate. Again, just giving her space and capacity to catch up with all the things. But this is fantastic news coming out of the FDA. It is a booster that again covers the most expansive and most recent variants. And they are trying to prioritize for the elderly and immunocompromised, which we really should be focused on at this time. So really good news coming out of the FDA, and we'll send more information about that for the board, but we'll also be educating the community in the coming days. Please all note that the IHN won funding on behalf of the 4 FQHEs around COVID-19 education. And so that education will also be, I'll be removing that from the very full plate of my comms team, and you'll be seeing a lot of that communication, knowing that it is directly sponsored by the health department.
That's great. And I saw that Kim put in a link to the announcement. Thank you, Kim. So any other questions for Dr. Monty or for the good of the order? That was a good discussion, and let's continue to follow these tracks. I appreciate that.
Dr. McBride, just want to acknowledge some other comments in the chat. Kristen, thank you so much for volunteering to assist with maternal child health. Bobby, if you could make note of the fact that there are 4 board members that want to be supportive of the maternal child health section, specifically in Linda Racklin, Dr. Colleen McNicholas, who you've already connected with and has offered support. Thank you, Dr. McNicholas. In Dr. Melissa Tepe and in Kristen Simpson. If you could, and I know Kristen specifically and individually is asking for more information. So if you could schedule a time to meet with Kristen and hear more about her work and see where she can support, that would be helpful. If we could try make sure that meeting is done within the next month.
Dr. Monty, I'm sorry, may I have those numbers, those names one more time?
Sure, Linda Macklin, Melissa Tepe, Tepe, Dr. Melissa Tepe, Dr. Colleen McNicholas, and then Kristen Simpson, NP, leader extraordinaire.
And you can add my name to that list too. Our center has done some work on maternal health.
So listen, Bobby, no excuses. The whole half of the board is saying they're here for all your maternal child health needs. So let me tell you something that I tell Bobby. When y'all offer, I tell him to get everything he can from y'all. So do not offer unless you're ready to go to work, because Bobby will put you to work.
There you go.
We appreciate all of you for those volunteer efforts. Dr. McBride, back to you.
Okay, that's what I have for the agenda. Is there anything else for the good of the order? We're almost up to 9:30, so perfectly timed.
Just a bit of a question, like, I mean, now that we're here, just a little more on the maternal child. Is that what it's called? Is it maternal and child or maternal child?
They say maternal child, but it doesn't make sense Englishly. So you're right, Bradley. And Englishly is also not a word, but here we are.
But I was wondering if you know, how that campaign and that effort is co-located with promoting a general sense of support of mothers beyond that time, right? That moms in our communities feel supported beyond even birthing. I just wonder if there are intersections and opportunities to kind of advance that as well. It just kind of showed up for me.
I'm going to give Bobby an opportunity just to speak since he's the head of this section, but Bobby, I can also add my thoughts around this topic as well, if helpful.
Yes, ma'am. Yeah, so Dr. Bradley, you're absolutely right. I mean, our program, we're looking at trying to positively impact pre, peri, and postnatal care. And so the portion that you described would definitely be that postnatal care aspect. When you think about different impacts of both the mother and the child, including like SIDS, postpartum syndrome and stuff like that. So yes, sir, we have reached out with local organizations, including Generate Health, Vision for Children at Risk, to see how we can partner with them to make sure that we're positively impacting those important topics within our community, because I can't agree with you more that that's very important. So we're in the process of developing those partnerships and plans to ensure that we are responsibly engaging our residents to ensure that they know that those services are out there.
I really want to thank you for lifting that up, because I was checked recently by Dr. Danielle Cabell, and I like being checked because sometimes people stop checking you when you're at the level I'm at. But she talked a lot about how we're constantly talking about the terror, the horrible statistics around Black women's birthing stories, and that we need to be lifting the joy up as well. So that PBS documentary speaks to that, but it also does address the fact that we really focus around the sort of pregnancy and delivery and not across the spectrum. And the monies that we put out were intentional about that. We have lactation dollars for people who focus on lactation. We talk about that doula support, and doulas are very thoughtful and purposeful about extending their support way past the birthing journey. So it's such an important part of this. And then I'm thoughtful of the fact that as someone who had a COVID baby herself, right, and I'm very privileged, still had a lot of trauma around, 6 months out when you're still, you're feeding a baby every 2 hours, whether it's from your body or from a bottle, right? There's a lack of sleep. There are months, even into the years, that we're not really checking in with mothers in general. And so I really love that statement. And I want me and Bobby to be thoughtful about all of our work not being too centered around one specific aspect of this very wide spectrum around the birthing journey.
Excellent comments. And Kristen, I see you have some comments in the chat, and you can voice them if you want, because I saw you nodding your head quite a bit.
I ain't gonna take all day, I promise. But it really is a public health crisis, and a lot of it has to do with the historical racism built in our hospital systems and not believing Black mothers when they say that something is wrong. And so it starts there and then continues into the communities that they live in, and how are we not really paying attention to the true barriers of access. And one of the ways we do that is asking them, what is preventing you from engaging with us? And sometimes the biggest thing is, I don't trust you because you don't trust me. And so part of that relationship, partnership, doulas are on the rise, and I am loving it. I had a doula for my birth experiences and am grateful, but I also have women's health experience. But you always need someone to be an advocate for you when you can't, when you're emotionally dysregulated. So I would love to see the world shift to a practice where everyone has an advocate in the birth room to speak for them. But I would love also not to need additional advocate in the birth room, because as healthcare professionals, we should be their first advocate. And so just really also reshaping the minds of the providers and what our role is, and to support all mothers, and also understanding that, yes, we can keep them safe in the couple of days that they're before us, but also what environment are we putting them back into, not considering what it means to parent, especially in those first couple of months, as Madi mentioned, where we're tired, we're trying to, there was a formula, what word am I looking for? Shortage. And that impacted the community in a way that none of us was prepared for. And so really trying to think about how people, and this may be the case where some people really didn't have access to formula before the shortage even happened. So just making sure before we blame mothers and say what they're not doing, how are we supporting them and giving them all the tools and resources they need to be effective. And that also means psychological support, because it is a journey to, have to have a human depend on you. So in short, there's so many ways that community partners and just so many different shifts that have to happen to make a better experience for Black mothers across the nation.
Well put. Thank you for that great statement. Appreciate it. Okay, and I think that's responsive to you, your question, Dr. Bradley, I assume. Yep, that's great. So are there any other things that go to the order? I think we're a few minutes over time, but. Okay, another great meeting as usual. Thanks to the staff from the department. And I don't know if I have to take a vote to adjourn, but I think I'll.
Motion to adjourn.
Motion to adjourn, and second. Anybody want to second that? Okay, great. See you next month. Thanks a lot.
Thank you.